Hi everyone, Dr. Remy from Pain Free and Fit and Posture Size. Today we've got some great personal training tips in terms of how to train your clients with patella tendinitis by modifying the style of squat you choose. We're going to talk about why sumo squatting is one of the safest styles of squatting for patella tendinitis. Hope you enjoy. So when modifying your lower body exercise program for your personal training clients with patella tendinitis, keep in mind the angle of the knee and the position of the hip joint in relation to the knee is crucial to how much stress is applied to that patella tendon and can make a huge difference in terms of avoiding painful aggravations of your client's patella tendinitis. In a normal squat, in a parallel stance, many clients have a weakness in their extensors of their spine as a result of poor posture, sitting where the glutes become weak, excess hip flexion. As a result of this, when they squat, they rarely have enough posterior or backwards translation of the hips, and the knees have a tendency to make up for this by utilizing more quadriceps by moving forward over the toes. This puts a great deal of pressure on the patella tendon that sits underneath the kneecap and can aggravate pain. But by switching to a sumo style stance, where they take a wider stance and angle their feet out from 30 to 45 degrees, the extensors in the spine aren't as extremely recruited, and you can have a more natural movement of the hips moving down and back as opposed to straight down. This allows the hip to drop back and the knee to bend with very little forward movement or translation over the toes. And if you stay within a degree of flexion of the knee that doesn't approach 90 degrees but uses more of a 45 to 60 degrees of flexion and then extension, you decrease the amount of tension in that patella area. Remember that the patella tendon has a lot more stress the more flexion or bend we have. Studies have shown that when it bends down to 90 degrees, not only is the tension in that tendon increased, but the shearing force between the front and the back layers of it also increases. One final thought when training in the sumo squat is to make sure that you have your client's kneecap directly over the center of the foot. Many clients will have a tendency due to hip posture abnormalities, habits of sitting with their legs crossed one side more than another, driving with one leg out, to have a rotational problem with their hips, where one hip naturally when they stand or squat or walk has a tendency to turn out, or they have a knee rotation problem where when the center of the kneecap is positioned forward, the toe or the shin actually ankles out more than what is centered. When this happens, as the knee is torqued, it creates a force on that patella tendon that can also aggravate it. So when you're sumo squatting, make sure that whatever angle you choose for your client with that foot position, that as they squat, they track their kneecaps directly in line with the second toe next to the first toe, the great toe, or pretty much the center of the foot as they squat up and down. Keeping these tips in mind can really help to reduce injury at the patella tendon, keep you training with your clients, allowing them to achieve their goals without hurting themselves. Hey, if you like this video on patella tendinitis and personal training, feel free to subscribe to our channel. We get a lot of great videos out there on knee injuries and other injuries when it relates to personal training. If you'd like to help me share this valuable information with others, give me a thumbs up below. Any questions or comments, I'd be delighted to answer them right in. And remember, we have a great course called the Essential Crash Course for Personal Trainers on Pain and Injury that teaches you everything you want to know about how to modify exercises, how to choose exercises, how to build a program using the 10-step formula, how to assess clients in terms of their mechanics, what they're going to need in terms of their goals, how to create a program that's going to not only avoid injuring them, whether it's a shoulder, knee, low back, hip, whatever cause, but also help promote healing in the body by avoiding the mechanical stresses that many times irritates our injuries. I hope this video on personal training your clients with patella tendinitis helps you keep your clients pain-free and fit.